Welcome to this educational overview of the WHO-aligned protocol for early medical abortion. Today, we are looking at the science behind the misoprostol-only method, typically used between weeks 5 and 9 of pregnancy. This video is designed to explain clinical guidelines to the general public, not as a guide for self-treatment. According to medical standards, the baseline for this specific protocol is 12 tablets, totaling 2,400 micrograms. Clinical guidelines show that this exact dosage is required regardless of a patient's body weight. Health professionals strongly warn that to avoid dangerous counterfeit drugs, medication must only be sourced in original, sealed aluminum blisters. How the medication enters the bloodstream is critical. Medical protocols recommend placing the tablets under the tongue to dissolve for 30 minutes, or using them vaginally. Swallowing them like regular pills is a major error. Stomach acid quickly destroys the active misoprostol, drastically lowering its effectiveness. The standard medical procedure requires a strict dosing sequence. The 12 tablets are divided into 3 doses, taken exactly 3 hours apart. Guidelines emphasize that a patient must complete the entire sequence exactly on schedule, even if heavy bleeding starts early, to ensure the pregnancy tissue fully passes. Why do doctors specify exactly 3 hours? Medical science shows this timing maintains the necessary uterine contractions. Taking doses too close together increases the risk of severe side effects, like high fever and intense nausea. Waiting too long causes the contractions to stop completely, highly increasing the risk of an incomplete procedure. Clinical data shows the primary reason this procedure fails is when a patient stops after the first 4 tablets. Stopping early causes uterine momentum to drop. This 4-tablet mistake leads to unpredictable, heavy bleeding for weeks and creates a significant risk of severe infection that could require emergency surgical intervention. While the protocol has a high success rate, there are strict warning signs. For example, if there is absolutely zero bleeding within 24 hours of the first dose, immediate medical intervention is required. Zero bleeding is a major clinical indicator of a potentially life-threatening ectopic pregnancy, where the pregnancy is outside the uterus. It is vital to know the emergency triage thresholds. Doctors advise going to an emergency room immediately if a patient experiences hemorrhage, like soaking more than 2 thick pads per hour, a high fever lasting over 24 hours, severe one-sided pelvic pain, or signs of shock like extreme dizziness and cold, clammy skin. Finally, the clinical protocol does not end just because symptoms stop. Healthcare providers strictly recommend a follow-up ultrasound 7 to 14 days later. This is the only way to definitively confirm that the uterus is completely empty and to rule out any retained tissue or hidden complications.